group of men for risk reduction, and that I think would maybe turn around and allay some of the concerns that you have.
Our third patient story addresses the question we've just been exploring, how the studies of medication for prostate cancer prevention might be translated into practice. Doug is 51 and lives in Dallas, Texas. He's had elevated PSAs and is being treated for an enlarged prostate.
I was born in Texas, and I've lived here all my life. I'm 51 years old. I have a wife and 2 children, and we really enjoy being outdoors. I've been camping since I was in Scouts as a boy. And now with my son in Scouts, we go camping regularly. Once you get all set up, you can just sit around and relax.
I remember when Doug turned 40, I felt like it was really time for him to go and get a complete thorough exam and make sure that everything was okay.
I'll ask you to have a seat up on the table, please. All right.
I had my first routine physical. My doctor told me, wow, you have a larger than normal prostate. They did a PSA test then, and it came back higher than normal levels. You should watch it. When I found out I had a large prostate, I just took that as okay. It's bigger, you know, somebody's got to have normal, somebody got to have big, somebody got to have small, and I just have a big one. But then a couple of years ago, I started having to get up in the middle of the night to go to the restroom. And then I'm like, I can't go camping anymore. Crawl around inside your tent, put your boots on. It's just too much of a hassle. I had another PSA test. It was a little higher, so they recommended that I go see Dr. Fulgram.
Doug first came to me in 2002. Over a period of time, Doug had some worsening of his obstructive voiding symptoms and, more importantly, had a rising PSA blood test.
How you been? Good to see you. How have things been?
Been pretty good.
The biopsy was negative for cancer, but his prostate had already enlarged far beyond what it should be for his age. And so we continued to treat him with a combination of alpha blockers and modification of his diet. In the last 6 to 12 months, he developed significantly worsening obstructive voiding symptoms.
And then I was getting up 5 or 6 times a night. You know, it kind of messes up your sleep.
And when he'd come home from work, he literally would be like charging in to go. And I'd say, geez, don't you go before you leave the office?
And I recommended a repeat biopsy. Again, the biopsy was negative for prostate cancer, but this time he had several cores which showed a precancerous condition. He's done very well after the biopsy, but his prostate is now enlarged to over 100 cubic centimeters. We clearly thought it was time to offer some additional therapy, either additional medical therapy or surgical therapy. He chose to go on the medication, and we actually get 2 benefits by him being on these 5-alpha reductase inhibitors. One is that it shrinks the prostate, but more importantly, there's been a very large study in the last decade which showed that taking 5-alpha reductase inhibitors may reduce the risk of developing prostate cancer by up to 25%.
The doctor wants to see me 4 times a year just to do regular exam and take a blood test. And I take 1 pill a day. I haven't had any side effects. What I have seen is improvement in that I don't have any symptoms where I need to go to the restroom, so it helps with my sleep. It's working, so I'm fine now.